Brenda here with the Hospice Care Plan. I think that one of the hardest things about the active dying process for patients, families, and caregivers is giving those comfort medications on a consistent routine basis when people have lost their swallow. You can do it. We do it all the time. It's why Nancy and I have lots of videos and instruction in our booklet on how to do it, because it's important to keep those comfort medications during the active dying process. In my 35 years of practice, I've seen things come and go, and I've watched our practices change. And I think that what's going to become a really new standard of practice that is really going to elevate our field and help make end-of-life care more comfortable, consistent, is the Macy Catheter. So what is a Macy Catheter? It's a rectal tube that is inserted into the rectum, and medications are crushed up, turned into a liquid, and you simply give medications in a liquid form through the catheter into the rectum. And it works brilliantly, and it absorbs quickly, efficiently, and the comfort medications, they work really actually better because they absorb so well, and it's easier to give consistently, because it's really hard for families to learn. There's a process to learning to give comfort meds when a patient isn't swallowing, especially when you have to escalate medications to meet the symptom needs. Sometimes it's just too much medication. And we've been using the Macy Catheter for a while, and I'm seeing it become the new standard of practice. Not all hospices will use the Macy Catheter. For instance, there's 5 hospices in our valley. 3 don't use it, 2 use it. I go to lots of different facilities, and when a patient in a facility is getting ready to go onto hospice, the facility will say to families, please choose one of these 2 hospices because they use the Macy Catheter. They know that it's easy to use, it's effective, it's easier for their staff, really easier on the patient. And if you're looking at a hospice, ask up front, do you use the Macy Catheter? Because it is really becoming the new standard of practice, and it makes it easier. And if you're on hospice and you're in the active dying process and you're struggling with it, ask your hospice for a Macy Catheter. Even if they don't standardly use it, they can get it very easily. So I encourage you to ask for the Macy Catheter, and it's just easier for everybody. As hospice is growing and changing, the hospice nurses just aren't there as much as we used to be. And so we have less time to show all how to do everything, which is part of the reason Nancy and I wrote this booklet for the bedside care and our YouTube video showing people how to do care and symptom management, because it is changing and people still need to have their needs met in the dying process. I think hospice does a great job, but it is changing and there's less time. So that's why we're coming up with things like the Macy Catheter and our Hospice Care Plan. So please go to our website, the Hospice Care Plan, to get our booklet. Google Macy Catheter and you'll find out about it. It's super simple to use, and join me in making the end-of-life care easier, better, more efficient. Thank you.